Hey everyone, today we're going to pull back the curtain on chiropractic care. Think of this as your personal guided tour, where we'll break down what it's all about, what these experts actually do, and how it might be exactly what you've been looking for. So, let's get started. First, let me ask you something. That ache you feel when you get out of bed, that stiffness in your neck after a long day, that pain that's just kind of become normal, what's really behind it? It's a huge question, and it's the one that starts the journey for so many people.
I'm willing to bet some of these look pretty familiar. From that classic low back pain that makes just sitting down a chore, to those debilitating migraines that can just wipe out your whole day. These are the kinds of things that send people looking for real solutions, because they show just how much our body's structure impacts our everyday life.
So, here's our game plan. We've got 6 key stops on our tour today. We're going to start with the basics, then we'll blow past the common myths, get into what treatment actually looks like, answer those questions you've probably always had, and then wrap it all up with what your path to feeling better could be.
All right, let's dive right into our first section, the chiropractic approach. This is where we lay the groundwork and talk about the expertise and science behind it all.
So, what exactly is a chiropractor? Well, first off, they're doctors. Doctors of chiropractic, to be specific. We're talking about healthcare pros who've gone through at least 4 years of postgraduate studies. And their superpower? It's specializing in musculoskeletal health, that whole amazing complex system of nerves, muscles, and bones that lets you do, well, everything.
And the care they provide, this isn't just some guesswork. It's a formal, research-backed field of healthcare. The whole point is to diagnose, treat, and even prevent problems in that system, all to help you feel and function better overall.
Okay, now that we have that foundation, let's build on it. In Section 2, we're going way beyond the spine to look at the huge range of conditions chiropractors can actually treat.
This right here is probably the biggest myth we need to bust. When you hear chiropractor, you probably think back cracking, right? But that's just a tiny piece of the puzzle. The reality is they are experts in any joint, muscle, or nerve issue anywhere in your body. And that expertise covers a huge range of conditions. We're talking about some really complex stuff like herniated discs, whiplash from an accident, carpal tunnel from typing all day, even chronic conditions like arthritis and fibromyalgia. This shows you it's not just about a sore back. It's about providing really specific care for specific medical diagnoses.
And this leads us to a really important idea: personalized treatment. Look, effective healthcare is never a one-size-fits-all deal. It's about having a whole toolbox of options to fix what's actually wrong with you.
And speaking of that toolbox, just look at this list. It goes so far beyond the classic adjustment. You've got things like soft tissue therapy and cupping to work on tight muscles, gentle mobilizations to get joints moving better, and even active rehab exercises so you can become a part of your own recovery. It's a totally hands-on, comprehensive approach.
Okay, on to Section 4. This is where we tackle some of those big questions head-on. Because let's be honest, feeling comfortable and confident with any kind of healthcare means getting straight answers.
You knew we had to talk about this one. It's the #1 question for sure. You've seen it in movies. You've heard people talk about it. What is that popping or cracking sound?
The answer is actually pretty simple, and it's all about science. It's not your bones cracking. It's the sound of a gas bubble being released from the fluid inside your joint. Kind of like when you open a can of soda. That little release is called a cavitation, and it creates a tiny bit of space in the joint, which allows it to move better and helps the muscles around it to finally relax. And that leads us to another really big question, especially if you're a little hesitant. Is the adjustment something you have to do? Is it mandatory? And the answer is a clear, resounding no. Absolutely not. Your comfort is always the top priority. A good treatment plan is a partnership. If adjustments aren't your thing, no problem. There are so many other effective ways to get you feeling better, like all those tools in the toolbox we just looked at.
Okay, moving into our 5th section, let's talk about what this all looks like in the real world. What does your journey actually look like when you walk through the door for the first time?
It's a really clear 3-step process. First, there's a deep dive, a comprehensive assessment of your medical history and what's going on with your injury. From there, the goal is to get a specific diagnosis, to find the root cause, not just chase the symptoms. And only then is a personalized treatment plan built just for you.
And, this quote from a patient named James really says it all. Check out those 2 words he uses: caring and holistic. That's the magic combination, right? It's that mix of expert knowledge with a real, genuine focus on the patient's whole well-being that builds that all-important trust.
And that brings us to our final stop on the tour, the takeaway. After all of this, what's the one big idea you should walk away with?
It really all boils down to this. This is not about putting a Band-Aid on a symptom. It's about a comprehensive approach that looks at your entire body as one connected system. The goal isn't just a quick fix, it's long-term relief and genuine, lasting health.
So as we wrap up, the last question is for you. Now that you have a clear picture of what's possible, are you ready to take that next step on your own wellness journey? Thanks so much for joining me on this tour today.